personally if we can't accept your questions, okay? So next speaker is Claudia Farina, please.
So good morning. So I'll be talking about genetic risk in extramacular drusen in AMD in the Coimbra Eye Study. My financial disclosures are below and none is related to the content of this talk. So genetic risk for AMD was previously evaluated in epidemiologic Coimbra Eye Study, which is a Portuguese study, and this included the genetic risk score analysis in both patients and controls. This new study, or sub-analysis, now aims to evaluate the evaluation between the sequenced genetic risk variants or the genetic risk score for AMD and the presence of extramacular drusen in subjects with and without AMD, and to explore if they share a common genetic basis or not. So I remind you that this is a 2-visit epidemiologic populational-based study, and in the follow-up visit, the incident study, we performed multimodal imaging for AMD phenotypic characterization and staging. We all performed genotyping in association with the iRisk Consortium. For the extramacular drusen analysis, we analyzed all the 3 color fundo photography that we acquired per eye for all subjects, and then we searched for differences between the genetic risk score in those only with AMD, those with AMD and extramacular drusen, those with only extramacular drusen, and in healthy controls. So, and then we tested for the associations between the 2 entities, if we can call it that, like that, and between these and the genetic risk scores for the patients. So we included 753 eyes, 7% with only AMD, almost 15% with AMD and extramacular drusen, about 30% with extramacular drusen only, and 50% were controls. And when we explored more the phenotype, we thought that in those with AMD, extramacular drusen, or globally more with a more severe phenotype, with more soft drusen, intermediate and large drusen, and with more confluent appearance in the fundus. So when we calculate for the genetic risk score, basically we found that there were no differences between controls and those only with extramacular drusen. There were only differences between these 2 groups and those with AMD, regardless or not they had extramacular drusen. In fact, those with AMD did not have differences in the genetic risk score, having or not extramacular drusen. There was, however, substantial overlapping, as you can see here in this graphic, with slightly superior risk with those with AMD, with or without extramacular drusen, and lower risk in those which were controls or only with extramacular drusen. Some examples to exemplify, so we can see despite having a low or high genetic risk score, they have a small extramacular drusen widespread in the fundus. And in this patient with a high genetic risk score, despite not having AMD, it has a symmetrical distribution of the extramacular drusen, but they were mostly small drusen in the superior nasal area. When associated to AMD, the phenotype was always more severe, almost always more severe, widespread across the fundus outside the arcades and the nasal area. Another case, you can clearly see the soft drusen in the nasal area as well. So when we went for the association analysis, we found that there's, as it was expected, a strong association between the extramacular drusen and having AMD, and also age, of course. And the same for when you included the genetic risk score in the analysis. But interestingly, when we do it on the other way, we found that both age, AMD, and even sex were associated with the risk of having extramacular drusen, but genetic risk score was no longer associated. So in conclusion, the genetic associations between the presence of extramacular drusen and risk genotypes for AMD have been explored, but with conflicting results so far, and our results show that there is indeed a strong and known association between the presence of macular drusen in AMD and extramacular drusen, which suggests obviously a common pathogenesis. And in fact, EMD, as we saw, tend to display a more severe phenotype when associated with AMD, but not as a standalone feature. So the genetic risk score that we calculate for AMD did not show, in fact, any association with the presence of extramacular drusen per se. So they appear, according to our results, to be not a sign of increased genetic risk for AMD. But I must say that since the genetic risk score and the way that is calculated is heavily based on CFH genotypes, Other genetic risk variants, of course, may be more related to the presence of extramacular drusen and might not be accounted for when you use this more global methodology alone. So thank you all for your attention. I hope you enjoy it.
Thank you. So while Professor Corbani comes up, can I just ask, how do you see this happening in a clinic?
What's happening
How will you incorporate the genetic score into your clinical practice?
Well, I think genetic risk score is not yet incorporated in clinical practice. You use it mainly for the investigation, of course, to test for the genetic risk of the patient. For now, it's just investigational, but it's not very practical to use genetic risk score in your clinical practice because you don't have really anything to do for that patients. Neither for treatment, not for, and even for prognosis is highly debatable. Of course, that in the future it probably will be a tool to be used in your AMD patients, but for now I think genetic risk score is just in the base of the investigation.
Thank you very much. And thank you very much. Is Professor Corbani here? I'll have his talk. If not, then Nancy.